Hi, I'm Dr. Catherine Krebs, and I'm a Medical Research Program Manager with the Physicians Committee, and I lead our efforts to better protect cephalopods used in research. Wednesday, April 3rd is World Aquatic Animal Day, an annual day dedicated to aquatic animals and raising global awareness about these often forgotten non-human animals. Aquatic animals are some of the most fascinating animals on Earth, and they play critical roles in their ecosystems. But they are used and abused for human consumption, entertainment, and in research and testing in ways that threaten their existence and sometimes even our own. Today and every day, the Physicians Committee honors aquatic animals by working to replace their use in research and testing with more effective, more reliable, and more humane non-animal methods. I'm going to tell you a little bit about our aquatic animal work in honor of World Aquatic Animal Day. Cephalopods are a class of aquatic animals that don't have backbones, such as squids, octopuses, cuttlefish, and nautiluses. Cephalopods are delicate and prone to distress, disease, and death when held in captivity. And they're intelligent, with complex nervous systems, unique behavioral repertoires, and capacity for pain. Cephalopods are used in a variety of federally funded research contexts, and evidence suggests that their use is increasing. But because they're invertebrates, cephalopods are excluded from the U.S. policy that regulates the care and use of animals in research and testing. After years of mounting pressure from the Physicians Committee, other advocates, researchers, and Congress, the National Institutes of Health took a major step toward better protections for cephalopods, releasing proposed guidance on their care and use in research. If put in place, this guidance would, for the very first time, require researchers who use cephalopods to obtain approval from animal welfare oversight bodies called Institutional Animal Care and Use Committees. These committees are required to consider factors like the justification of using cephalopods over non-animal methods, appropriate sedation and anesthesia, and the impact of experimental procedures on the animal's well-being. This measure would bring the U.S. more in line with the growing global consensus that cephalopods suffer in captivity and invasive experiments. But our work doesn't end there. Better protections for research cephalopods won't mean they'll stop being used. The Physicians Committee will continue to advocate for these animals until they're left in the ocean where they belong, and medical research shifts to more ethical and effective non-animal approaches. The Physicians Committee also works to end the use of horseshoe crabs, whose blood is used to test the safety of certain medical products. Perhaps you've seen these animals on the beaches of the Atlantic East Coast of the U.S. Every lot of injected medication, vaccines, and some medical devices are tested for fever-inducing contaminants. This is an important safety test, and fortunately, multiple non-animal approaches exist that can safely provide the needed information. The Physicians Committee has brought together pharmaceutical companies and government decision makers and learned that many see the clear benefits to the non-animal approaches. The non-animal approaches are scientifically superior, avoid the supply chain vulnerabilities of relying on the blood of a wild animal, instead offering a stable, scalable supply, and help companies carry out commitments to reducing and replacing animal use. We advocate for crucial policy changes that would provide clarity for companies that the use of the non-animal approach is acceptable, so companies no longer need to use the horseshoe crab blood-based test. The pharmaceutical company Eli Lilly has already begun using the non-animal approach, and many other companies are already doing the work internally to get ready to make the switch. So we're on our way to make bleeding horseshoe crabs to test for contaminants a thing of the past. Ultimately, our work will continue until we've completely phased out ineffective animal research and testing, including aquatic animals like cephalopods and horseshoe crabs. More than 100 million animals are used in U.S. laboratories each year, contributing to clinical trial failures and wasteful federal spending on research. We'll continue working with government agencies, Congress, and industry to reduce research and testing reliance on animals and improve the applicability of medical research to humans.